Okay, we're here at the Healing the Eye and Wellness Center, and during our program, I will give talks after lunch. And today we're talking on my favorite topic, and that's homeopathy. And homeopathy is really how I got interested in alternative therapies. I started out as a traditional eye surgeon, thought I had all the tools to take care of any eye problem, either with drugs or surgery. You know, homeopathy didn't enter into my mind, although I did consider, nutrition and healthy living as, part of my program, but I really didn't think that that had the ability to really take care of chronic disease. Then I discovered homeopathy because I developed severe asthma and on 3 different asthma medications, and each medication caused a side effect. And one of the side effects was a severe tremor. And you can't be a good eye surgeon if you have a tremor. So I'd walk up to a patient and go, "Mr. Smith, you need surgery," and my hands would be shaking, and they'd probably want to get a second opinion. You want a surgeon that has good, steady hands. So I went to, my neighbor was one of the top pulmonary doctors in the city. And I said, "Dave, I want my old lungs back. I didn't smoke, didn't have any allergies, and why did I get this asthma?" And he told me, "Well, there's no cure for adult onset asthma, just like many of you have been told there's no cure for your problem." And he also told me, "Make sure you take your medications, because if you don't, you could die." But in the meantime, I almost died twice, shoveling snow in Pennsylvania. You know what it's like.
Yeah, I know.
I was miserable. So when I did operate, I would take a beta blocker, which would stop my tremor, but the beta blocker would make my asthma worse. And that's like many of you out there who are taking multiple medications. You get a side effect for one medication, then they give you another medication to take care of that side effect. And pretty soon, you have a shopping bag full of medicines, and you're getting sicker and sicker. So I heard about homeopathy because at that time I was running marathons and doing triathlons, and a lot of the professional triathletes were taking homeopathic remedies, and I thought, well, maybe that could help me with my asthma. And if there was ever going to be a placebo effect, it should have occurred when I took that first remedy, because I thought, I was really optimistic, this is going to help me, this is going to get rid of my asthma. But it didn't do a darn thing. So I went back to my homeopathic doctor, and they prescribed the second remedy. And that maybe helped a little bit, but it wasn't really anything that pronounced. But it was the third remedy that just produced an unbelievable change. My asthma just disappeared. Got off all my medications. But I still carried my inhaler around for about a year because I thought, it may come back and I'm not going to be dependent on this. So what is homeopathy? And it's really difficult to explain what homeopathy is because we're brought up in an environment where we're looking for immediate cures. We're also brought up in an environment where we feel that the body is like a piece of machinery. If you have a heart problem, open up the blood vessel. If you have high blood pressure, lower it. You got high eye pressure or glaucoma, we treat with opposites. You have a fever, cool the body. So in homeopathy, it actually looks at the underlying cause. So before I talk about looking at the underlying cause, let's look at common ways of treating disease. Or before I even start with that, what is disease? And this disease is dis-ease. It's a imbalance or a lack of harmony in your body. Something is off balance. And if you believe that our bodies are made in the likeness of God, they're supposed to be perfect. And if you believe that the body has an intelligence, every time we get a symptom or a problem, it's because our body needs it. So let me try to explain that. Let's say you develop a high fever. Well, maybe your body needs a fever. You have to have that high temperature to get rid of toxins or fight an infection. Let's say you get diarrhea. Well, maybe it's the food you ate, or you have an infection. The body has to get rid of something. So if the body has an intelligence, whatever symptom or disease you develop, it's because the body needs it for homeostasis. So the two main schools of thought is the traditional medicine, or allopathy, as they call it, which treats with opposites. So if you have a fever, they give you a medication which lowers your temperature. If you have high blood pressure, they give you something to lower your pressure. If you got diarrhea, they give you something, constipation. If you got wet macular, they give you something to dry the macula. If you have dry, they give you something to make it wet. If you have high eye pressure, they give you something to lower it. So they treat with opposites. Now the homeopathic approach is, okay, we believe that the body has a wisdom. Why not help the body in what it's trying to do? So if you have a high fever, it's because your body needs it. So why not give the body or give the person something which causes a high fever? If you have diarrhea, why not take something which causes diarrhea? Now you may be thinking, Dr. Kondrot, that's nuts. If I got diarrhea, I don't want to take something that cause diarrhea. I want to get rid of it. But just bear with me. If the body has an intelligence and it's trying to do something, let's help it. So when I was cured of my asthma, I was actually given a homeopathic remedy which causes asthma. So it's helping my body do what it wanted to do. Now there's another philosophy or approach in medicine that's becoming very popular now. It's called functional medicine. And I know a lot of doctors are getting away from the allopathic approach. So instead of treating with opposites, they try to find out what is the underlying disturbance. And they look at it in terms of numbers. So maybe you have arthritis because your thyroid's low, or your testosterone or estrogen are in balance, or your cortisol is out of balance. So they kind of balance the numbers. But that approach really isn't the homeopathic approach. Homeopathy believes that you have a disease or illness because there's some type of disturbance in the body. And the way I'm really attracted to homeopathy is that it's the only approach that we have in medicine that actually looks at curing a disease. There's no other discipline in medicine outside of surgery. You know, if you have a problem, you just cut it out and remove it. But homeopathy actually looks at curing a disease. So if you have high blood pressure and you go to the doctor, he doesn't sit down with you and go, well, let's figure out a way how we can cure your blood pressure. No, they just do some measurements. They go, well, you need this medication. Come back, oh, the pressure's a little bit better. Let's, continue it. In other words, traditional medicine kind of maintains your disease. It really doesn't look at curing. The functional medical doctor will maybe find out you have an imbalance of your thyroid and recommend thyroid medicine or put you on some testosterone. Once again, they're not really trying to cure your disease. So, getting back to homeopathy, the homeopathic doctor looks for the actual etiology or cause of the disease. And that gets to be a very complex subject, because if you believe our body has a wisdom, then there has to be a reason why we're developing our particular problem. And sometimes we don't understand it, but we try to. That's one of the goals as a homeopathic doctor. So one thing I do as a homeopathic doctor, I talk to you, and try to find out what are the stresses, what are things that are upsetting you, what was going on in your life when you developed that particular problem. I see a lot of patients, they maybe had some trauma, they were in a car accident, and what is music to the homeopathic's ear is when they hear, I've never been well since. I've never been well since my car accident. I've never been well since I got the divorce. Or I've never been well after I had my surgery. That means something happened during that time period. So the other thing I like about homeopathy, homeopathy treats not only one disease or symptom, it treats the whole person. And modern medicine has gotten away from that. You go to the eye doctor for your eyes, you go to the gastrointestinal doctor for your stomach problems, you go to the rheumatologist for your arthritis, you go to the dermatologist for your skin, but no one's treating you. They tend to look at each little individual part and they give you a medication. And that approach sometimes just doesn't really help your underlying problem. So to illustrate this causative factor and underlying problem, I like to tell a story about a doctor that I treated. He was lecturing in Pittsburgh and he developed sudden blindness in his left eye. And he went to the top retinal specialist in the city and they diagnosed a blockage of the artery, a central retinal artery occlusion. And it's a serious problem. I was taught in medical school in my ophthalmology training. Once you get a stroke to your eye, there's nothing that can be done. So what they did is they confirmed the diagnosis and they put him on Coumadin or a blood thinner to prevent it from activating to the other eye. And they also did, a vascular workup to see what was going on with his body. But he was a doctor from India, and homeopathy is really popular in India. There's a saying that if you throw a stone into a crowd of people in India, you'll hit 5 homeopathic doctors. It's like every other person's a homeopathic doctor. So he came to me when I was just beginning my homeopathic training, and he said, I want you to help me with my eye problem. And I said, Dr. Dada, I'm not really familiar with homeopathic treatment of this problem. That homeopathy, remember, treats the person, not the disease. So if I have 100 people with glaucoma, it's not like I have one eye drop for everybody or one homeopathic remedy. We treat the person. So, if I have 10 people in this room and they all have macular degeneration, they're all different. And if you look around the room here, the way you're sitting, your legs are crossed, you're sitting a certain way, your hands up here, you're wearing different colors. We're all different. We're all individuals. We all have a different life story. We have different stresses, different problems. We react differently. So one thing I did with Dr. Dada, I said, well, let's find out what's going on with you. What could be the underlying cause? So when you do a homeopathic interview, you want to find out about the person. So all of you will have a homeopathic interview here, and it's just, I kind of talk to you as a friend. What are your likes? What are your dislikes? Where were you born? Why do you have the current job that you have? Do you like your job? What makes you happy? What are your hobbies? Because we're finding out what your personality is like. What makes you unique? And what obstacles have maybe interfered with your life? So I'm talking to Dr. Dada, and I found out it was interesting. He said, I love to argue. I said, tell me more about that. He says, well, I just love to argue. Even if I'm arguing with somebody and I know I'm wrong, I just like to wear them down to me and then I'm right. So I thought that was kind of peculiar. And I knew I didn't want to get into an argument with him right then and there. So I'm talking to him a little bit more, and I said, well, right around the time you lost your vision, anything unusual happened? And he thought for a while, and he told me, well, I lost an argument to my wife. Now, a normal eye doctor would say that has nothing to do with you getting a stroke. But to a homeopathic doctor, the light bulb went on. That's it. That's his case. that incident affected him, caused him to have a stroke in his eye. So I selected a homeopathic remedy, based on not only the fact that he got a stroke, but it was emphasized more of his personality. We may have like 80 different remedies for a stroke, but not all the remedies are kind of like his personality, argumentative, the shock of losing, do you follow me? So I gave him that remedy, and I said, he was going back to, he was from Louisiana, at Tulane. He went back there to continue his work, and I said, well, let's talk in a week to see how you're doing. So I called him up in a week, and Dr. Dada, how are you doing? Have you noticed any changes? And he said to me, perfect remedy, Dr. Kondrot, perfect. A couple of days after I took the remedy, my vision started to get better. Now it's completely normal. And I was kind of shocked. And he could tell I was shocked, and he said, Dr. Kondrot, what do you expect from homeopathy? And that kind of changed my opinion, because we tend to go into a situation with preconceived ideas, like I did with my asthma. The doctor told me there's no cure. I'm telling you, anything has a potential cure. In the book called Course in Miracles, they talk about miracles, and they said the universe knows no difference between healing advanced cancer and a headache. It's a simple problem that can be corrected. So no matter how severe your eye problem is, I think there's a solution. And so that was truly a miracle. So I kind of changed my mind about homeopathy. Now, the problem with homeopathy, it's not easy. If it was easy, everybody would be doing it. I've been studying and practicing homeopathy for over 20 years, and it seems like the more I read and more I study, the less I know. But I do know that a homeopathic remedy can really help uncover the underlying disturbance in your body and help begin the healing process. So we're meant to have perfect health. That when we have this disharmony, these traumas and shock, and life is full of these traumas and shocks, which cause a disturbance. Unfortunately, traditional medicine doesn't look at the underlying cause. They just, what we call, suppress the disease. To give you an example, if a child has eczema, goes to the pediatrician, they put them on steroids. The steroids get rid of the eczema, the skin's nice and clear, but then later on the kid will develop asthma because the disease process was pushed deeper. Now they have asthma, and if the asthma is treated improperly, pushed deeper, then they may get heart problems. And finally the disease gets deeper and deeper. In homeopathy, we understand that. There's a progression of disease from the outer part of the body, deeper and deeper and more serious. Homeopathy, we also look at the highest disease is a mental or emotional problem. Then you have the physical. So normally when you're given a homeopathic remedy, we like to see an improvement in your mental and emotional state first, then the physical. So let's say you have macular degeneration, you get a homeopathic remedy, and a couple of weeks from now, you say, Dr. Kondrot, that was a beautiful remedy, my vision is so much better, but I can't sleep at night, I'm irritable, I have sudden outbursts of anger. That's not a good remedy. I'd much rather have you take a remedy where you say, well, it really hasn't affected my vision that much, but you know what, I'm much calmer, I have more energy, I'm happier. That's a good homeopathic remedy because eventually the physical will heal. We like to go from the mental, emotional to the physical. That is truly good healing. Truly good healing. So these are all things that we have to be aware of. The other thing in homeopathy, we tend to look at disease as outside of us. our problems come from outside of us. But the homeopathic philosophy is that disease comes from inside. You have a disturbance, it's manifested in your environment. So if you're an angry person, then you meet a lot of angry people. If you're impatient, everybody else around you is impatient. So as you change, your environment changes, and that's a sign of good health. And I always enjoy talking, men as a rule are not in touch with their emotions as much as women are. So I have to laugh. I remember I talked to this one guy after I gave him a homeopathic remedy, and he said, well, I haven't noticed anything with the remedy, but my wife isn't irritating me as much. So, and I hear in the background, now make sure Dr. Kondrot keeps you on that remedy. See, he felt that he wasn't changing. It's just his environment was changing, but actually his perception was changing. I remember treating an engineer, and the engineer personality, narrow tie, pocket protector with all the pens. This guy had glaucoma, and he'd come in every month or so. He'd have his notebook, and he was marking down the time he took his glaucoma medicine, the time he ate, the time the pressure was taken. He was like making graphs and plotting things to try to, like the engineer, trying to understand everything. And he would drive me crazy with all kind of questions. And he was on 3 different medications, and his pressures were still high. And I said, Mr. Smith, these eye drops are not working. We're going to have to operate on you to lower the pressure. And of course, he wasn't too happy about the surgery. And I said, well, as an alternative, why don't we try homeopathy? I'm beginning to study homeopathy, and homeopathy might help you with your condition. So he was all for it. So I took his case. We talked for about an hour about everything that was going on in his life and his glaucoma, how it was affecting him. And I prescribed a homeopathic remedy, and I said, come on back in a month, and we'll see if it had any positive effect. So 1 month later, I can remember that day, I walked into the office, and the girls in the office were saying, oh, Mr. Smith, we didn't recognize him. He's really changed. And so I was really curious to go into the exam room to see what happened. So I walked into the room. There he was, had a sweater on, didn't have his narrow black tie, didn't have his pocket protector, didn't have his notebook. I was kind of shocked. And he was sitting there very relaxed. And I said, well, Mr. Smith, have you noticed any changes since you took the homeopathic remedy? He said, no, it didn't do a damn thing for me. He didn't notice anything. I said, well, where's your notebook? And I decided I didn't really need it. I said, well, you're kind of dressed differently. Well, I just didn't like it. I don't like the tie anymore, and I want to be more relaxed. So it did cause a profound change in him. But he felt the remedy had nothing to do with it. And his pressure did come down. We weren't able to stop all his eye drops. But it had a shift in his whole health. So we always have these events that happen. They kind of lead to a disharmony in our life. And our body reacts by producing a disease. So I have to ask all of you, and this is one of my goals, is what is it that you don't want to see? Because when you do have problems with your vision, I believe if your body has a wisdom, there's something you don't want to see. And I know as you get older, I'm 70, and I'm at the prime age for getting macular degeneration. And what does macular degeneration do? It blurs your central vision, right? So even though I feel like I have a lot of energy, when I look in the mirror, I go, what the hell happened to you? Where's that 20-year-old guy that I knew, So if my body can't handle it, I'm going to get a blurred spot. When I get up in the morning, I look, you're still looking good, guys. Blurry. And my wife looks great. Honey, you never look better. I don't see the wrinkles or anything. So it could be a protective mechanism. Or sometimes I see a shock. grief, you lose a loved one, and the trauma is just too much for you, and you begin to lose your vision. So there's all these factors. And I'm not saying that every eye disease has this emotional factor, because it's very, very complex. Sometimes it's just a physical problem. So my approach is not only a homeopathic approach, but I look for other things, because homeopathy, if homeopathy was easy, I would say, that's all I'm going to do. That you folks are here because you want help with your vision. You're not going to wait 3 to 6 months for a change, right? You want something right now. So that's why we're doing things like microcurrent, the IVs. So we're attacking it from two sides. We're addressing maybe some physical limitations or problems, maybe some nutritional, maybe circulatory, maybe decrease in oxygenation, things like that. And at the same time, we're doing the homeopathic approach. Homeopathic approach is more long-term. So, you're committed to a year program, and I'm going to be working with you for a year. So just like myself, the first homeopathic remedy didn't do much. So we may want to change it. So we want to know what happens over the long term. So any questions? Have I totally confused you about homeopathy? Or have any of you had experience with homeopathy?
I've taken remedies like arnica, nux, and different ones.
Yeah. Most people have an introduction to homeopathy with first aid. I mean, it can be amazing. Arnica. The other thing is homeopathy was meant to be a medicine for the people. The early pioneers had their homeopathic remedy kits, and they treated their own problem. And for first aid, and I know that many of the mothers that work for me in my practice, they use homeopathy on their children. Teething kids, fevers, and things like that. I mean, it can be remarkable. I can remember my middle son, Ryan, fell off his bicycle, and he came in screaming, Dad is grabbing his knee, and And I said, oh my goodness, I got to take him to the hospital. I think he broke it or something like that. So I was going to run up to get the car keys, but I had some arnica, which is for injury. I said, here, Ryan, take this, or this will help. So I put some arnica pellets on his tongue. I ran up to get my car keys. When I came back, he was on his bike. That's the kind of things you see with homeopathy. And I can remember myself, I was hurrying to go to work, and getting out of the shower stall, I hit my toe on the concrete ledge. I really hit it hard, and it was black and throbbing. And, I started taking some arnica. Didn't do anything. And I was in agony. I worked that morning, and I had a golf that afternoon. I had a golfing date with some of my friends. And I'm on a golf course and taking arnica, still having pain. And I'm saying, well, maybe homeopathy doesn't work in every situation. So I go back home and I take out my homeopathic books and I'm reading, and I come across the homeopathic remedy Hypericum. It's for injury of the toes, digits, with nerve innervation. I said, well, maybe it's Hypericum. So I took some Hypericum, and a couple of minutes after taking Hypericum, the pain went away. I was actually able to put all my weight on my foot. So that's the other nice thing about homeopathic remedies, that if you take the wrong remedy, it doesn't have an adverse effect. So a lot of people are introduced to homeopathy through first aid. You have a fever, take a homeopathic remedy. You have a cold, it's wonderful for colds and flus. So, homeopathy is a really important part of the program here. We want you all to get a good homeopathic remedy.
I ordered the kit that you talked about on the podcast. Mm-hmm. So you have that small kit.
But while you're under a constitutional treatment, I don't want you to take any homeopathic remedies. If you're having a problem, I want to hear about because we don't like to mix homeopathic remedies. So when I give you a homeopathic remedy, that's the only one I want you to take.
If you stump your toe, no.
No. Give us a call, we'll tell you something else to do, but don't take another homeopathic remedy, because that could interfere with what's going on.
Better hide them.
Now you can treat your husband with it, or your kids, all right? But don't take it yourself, because that could interfere with the homeopathic remedy.
What about the coffee?
Well, there's two different schools of thought. I tend to be a little bit more relaxed. Also, I use LM potencies. LM is a homeopathic remedy you take every day. It's more gentle to the body. I used to prescribe with a centesimal. Centesimal is a really high potency that kind of pushes the body, gives it a good hard shove. And when you take the centesimal potency, you have to avoid coffee, mint, no dental procedures. There's like a list of 50 or 60 things you can't do. The LMs, because you take it every day, you can have these indiscretions. You know, mint, coffee, without ill effects. So that's why I like the LMs. The LMs tend to be a little bit more gentle. The only thing I ask you is that you don't begin any new treatments or therapies. If you start the homeopathic remedy, don't go to your family doctor and start hormonal treatment. Don't go to the chiropractor and get a whole new set of back manipulations. Or don't start acupuncture treatment. Don't start anything new. If you are getting massage or getting a chiropractic adjustment every week, continue that. So if you are doing something, continue it as you are.
So a magnet, we have a PDMF. Is that okay?
You can continue that.
Infrared light?
Infrared light, you can continue all those things. Because what I don't want to happen is, let's say you stop all those things, and you're worse, and I'm thinking the homeopathic remedy caused it, but it's because you stopped your routine. Same thing with your eye drops. If you're taking eye drops, you continue the eye drops. Don't stop them. The only time I want you to stop if you are getting injections, I'll say, well, let's hold off on the injections to see how your eyes do.
Injections for your eyes or
Injections for your eyes, yeah.
not cataracts?
Not cataracts. Okay, that ends our homeopathic talk. Those of you that are watching this, if you want more information, go to healingtheeye.com. That's all one word, healingtheeye.com. This is Dr. Kondrot. Thank you so much for listening.